Thank you. All right. Can everyone hear me? Like the previous presenter, I also am a wanderer when I speak, so this is going to be new for me. Space bar for that or next?
You can do.
We'll get it.
Oops.
There we go. All right. Thank you, Jill. As Jill said, my name is Ben Lohr. I am the VP of Business Development for CrossTX. And what I want to talk about very briefly today, we'll talk about it in excruciating detail probably tomorrow. That's probably the wrong adjective for it, but it'll be a lot more information. And I don't want to keep anybody from lunch. So we'll keep this pretty brief today. What we're going to do is talk a little bit about who CrossTX is and what the pilot program for care management in Michigan RHCs is going to look like as we partner Jill and I together. There is a typo on here. Oh no, they fixed it for me. Thank you. I appreciate that. A little bit about CrossTX. We're a care management company. We work specifically with RHCs all over the country on care management programs that encapsulate chronic care management, principal care management, if anybody has any specialists that work in their RHCs, as well as behavioral health integration. Just out of curiosity, of the people here today, who's using or running a CCM program or BHI or PCM, anything like that today? Okay, just a few. Oh, more. Very good. So obviously, as we develop this pilot program, we're not looking to replace anybody's CCM or care management program. This is a design pilot program to help enhance and educate and be an assistance to you guys. CrossTX has an actually unique two-pronged approach for care management approaches. As you can see here down at the bottom, we have a software as a solution, which is a HIPAA compliant, fully integratable software that allows for individual organizations to stand up in-house programs, which I know is obviously the thing that most people want to do. You want to run it in-house, use your staff, the people that your patients know. So we have a way to support that. But what we also have that puts us in a very unique position around the country is we have a live nurse support program. This is not a big box call center. This is somebody local to your area that works with us that we can insert directly into your practice, whether in person or virtually, to run these care management programs for you. So little teaser about the information for tomorrow. We're going to talk a lot more about those two unique approaches tomorrow, but I wanted to give that today just to kind of wet everyone's whistle. Now, as we talk about this pilot program that Jill and I have developed together, there are really four ideal goals that we want to accomplish. The first is advancing CCM and related CMS fee-for-value knowledge in the participating Michigan RHCs. Ideally, we want to utilize at least 10 Michigan RHCs to drive this pilot program. We want to assist in standing up care management programs in these 10 RHCs or support the existing care management program that already exists within that RHC. And whether we're going to use the SAS model, the nurse model, or just an assistance or support type of role. And we possess, like we said before, the ability to support both the software and the nurse program. Now, what's included in this pilot program? The first thing that we want to do when we partner with one of the Michigan RHCs is we want to do a full financial pro forma. We want to look at the impact that care management can have on your organization, not just in reimbursement for care management, but how are we going to impact your quality metrics, annual wellness visits, colorectal cancer screenings, mammograms, whatever the quality metrics are that are important to your RHC, we want to factor that into the financial pro forma. Not only that, but we want to take a look at if you're a part of an ACO, how we can help impact the overall cost of your patients to hopefully drive up your percentage of shared savings. Secondly, anybody in here know Faith Jones through health tech? Nope, that's okay. Faith is somebody that's worked with CrossTX for a number of years. She's actually one of the people that helped write some of the language in the initial CCM adoption legislation in 2015. What the 10 participating RHCs will also receive as part of this is a free consultation with her about care management, question and answer, tips and tricks, best practices, anything that you want to utilize Faith for, you can. And lastly, we want to develop a report for Jill and everybody in the Michigan Office of Rural Health to understand how chronic care management or care management in general is both being adopted within the RHCs of Michigan, but also how they're performing, not just in adoption, in enrollment, but provider adoption, quality metrics, ACOs, all of the aspects of care management. We want to measure it and do essentially a published report with them about the efficacy of care management and how it's being utilized in the RHC space in Michigan. I promised it would be brief, and it really was. I didn't lie. But are there any questions today that you'd like to have answered? As I said, tomorrow we're going to do a much longer presentation, a deeper dive into all of this. But if there are any questions right now, I'd be happy to answer them. All right. I have some documentation with me. If you'd like, you can come over and grab it. It's just a one-sheeter with a little bit of information about CrossTX on it. If not, I'll have them available tomorrow as well.